Hello and welcome to the Sachs Institute's new video series. It's entitled From Data to Decision, the Power of Research in Policy. That pretty much sums up what we're trying to do, where we want to explore the impact of research on public health policy. For our first episode, I'm delighted to welcome a very distinguished public health researcher, Becky Freeman. Becky is an associate professor at the School of Public Health here at the University of Sydney on Gadigal land on a very wet and windy Friday afternoon. Becky has over 20 years of experience working in tobacco control. She's also very interested in how social media influences public health and the potential of the internet to circumvent tobacco advertising bans. More recently, she's been involved in research and policy around vaping, and that's what we're here to talk about today, because vaping is an emerging public health issue. There's been a lot of movement in the regulation around nicotine vaping, both here in Australia and internationally. At the same time, it's an emerging research subject as well. And the amount of research on vaping has been ramping up. So I'd love to get a better understanding of how these two things are interacting, how research is impacting on policy, and maybe vice versa as well. So Becky, welcome, and thanks so much for taking part in this video series. To kick off, maybe you could tell us why you started looking at vaping and when and why.
Sure. Thanks so much for having me, even on this rainy day. It's nice to have a chance to talk about my work. Oh, look, when we think about vaping, I think we all have a really clear picture in our heads right now of these brightly colored devices that smell like fruit or lollies or pancakes, and that they're sold to kids. But about 10 years ago, when the e-cigarettes were first invented, they looked like literally little plastic cigarettes. They had a few puffs on them. They weren't really that popular. They didn't get used that much. And it seemed like quite a fringe issue. And now you fast forward to today, and we have these products like I just described that are clearly marketed to kids, sold to kids, and used by kids. And that's what really spurred me to want to work in this area. When we started hearing stories from parents and teachers saying, what are these products? Why are they popping up our schools? What is this in my kid's bag that looks like a pen, but he's sucking on it? Is there nicotine in here? What's going on? And then of course you just had to walk around, the CBD here in Sydney, and every other shop, it seems, is selling these products. And when you look at the legislative environment in Australia, where nicotine is classified as a poison, what's going on here? You can't just add nicotine to any product you like and sell it. Nicotine vapes are technically an illegal product. But when you tested these vapes that were being sold in convenience stores, petrol stations, they invariably contain nicotine. So that's what really spurred me on. And wanting to work with the Cancer Council of New South Wales in particular in gathering evidence and research to get a clear picture. How big a problem is this? Who's using these products, and where are they getting them from?
And briefly, what do you think the important findings of your work have been?
Generation Vape has been such a great project because it's really provided that information that we just didn't have. We had kind of a blank slate. We had some population level data saying these are increasing in use, but we had no real concrete information of where are kids getting these products from? How are they using them? Why are they using them? How much are they paying for them? What are the devices like? And so having a really concentrated survey like that was funded by New South Wales Health, Cancer Institute New South Wales, the federal government, Cancer Council New South Wales, Cancer Institute New South Wales, having all these partners at the table who were crawling out for this data because they wanted to do an evidence-led policy change, evidence-led program change.
From the beginning, when you were thinking about research, were you shaping the topics around the idea of impacting health policy?
100%. To me, that's the main impetus for doing this research, is knowing that what we had in place, the policy we had in place, where nicotine is a Schedule 7 poison, nicotine vapes aren't legal to be sold. You had to have a prescription to get your hands on one, and yet we're seeing vapes being sold everywhere. Clearly our policy is not working. Something is falling down here. What's going on? And surveying young people, their parents, their teachers, and young adults across the community to get a really clear picture to say, what policy response do we need? And it became very clear after our first wave of data collection that it was about access. Young people said it was super easy to get their hands on these products. They knew exactly where they would have to go if they wanted a vape, and that they were being offered them from friends. They could buy them in shops, they could get them online. And yet this is a product that technically is illegal. And working with both policymakers, program managers, talking to NGOs, partnering with NGOs from the very beginning, because Generation Vape is absolutely 100% led by the Cancer Council of New South Wales. And I'm very fortunate that I've had really good relationships with NGOs as part of my academic career always. And being invited to work with them and lead this project as the chief investigator, I mean, it's exactly what a researcher would want. It's fantastic.
So were policy makers embedded at every stage of this, or were you talking to them before you decided on your research project, and then during and after? Is that how it works?
Yeah, I mean, I don't think we can really separate out academia, NGOs, policymakers, politicians. It's quite artificial to put all these people in these lanes and separate them out. There's so much crossover. And of course, most of our public health policy is driven by evidence. And without it, you're just kind of guessing what might work. And for me, I don't want to do research that doesn't have any real-world impact. I want it to be useful and valuable and immediately get in the hands of people who can do something with it. And of course, I love to publish in journals and go to academic conferences. But seeing your research being read at a parliamentary hearing, or having a politician quote your research in a press release and then say, and because of this research, we know we need to go in this direction. It's what I think most academics, and particularly in public health, want. What we live and breathe.
So how do you, who exactly are you talking to, and do you just sort of pitch them cold? Is it MPs, is it ministers, is it civil servants? And how do you sort of, I think other researchers like to know how you sort of make the initial pitch to them.
This is going to sound very untechnical, but it's all about relationships. And I've worked in this field for a really long time now. And I know my accent's Canadian, but I've been in Australia or down under, I should say, since 2004. And just worked with people in tobacco control. People who work in tobacco control are really committed to the field. So people who've been in the NGOs, even in the policy space, have been around for a long time. And so we have a lot of experience of going through the plain packaging laws together. And you form working relationships. You work with the people you like to work with. You get invited to the table. It's a dialogue back and forth. And I think one of the most valuable things you can do as a public health academic who wants to influence the policy space is to work with NGOs in particular. NGOs, that's their bread and butter. They understand that they need to push for policy change. They've got to bring the public along with them. They've got to bring MPs along with them. But they really want to be evidence-based as well. And as an academic, that's the part that I can give, that I can bring in. And it's the same with people who work as public servants behind the scenes. A lot of these people, you don't see them out talking to media or being the leading voice, but the role they play is crucial in getting your work into the hands of decision makers. Having excellent relationships with public servants who you can help them prepare briefing papers, respond to their emails really quickly, just be there as a resource. And then when it's time to ask questions like, what's going on with vaping? We need some answers here. You're going to be the person who has that relationship with them. You're going to be there. You can be like, I can do that study.
So
I can help you.
It's a bit kind of a long haul thing of building up relationships.
Yeah. I don't think there's that when we all get those ads on social media, right? 7 easy tricks you can employ to lose belly fat or whatever, those nonsense kind of ads. And it's the same with, I teach public health advocacy here at the university. And my students, same thing, they're like, oh, what can we do to be effective public health advocates? And I'm like, well, first of all, you do need to be in it for the long haul. I mean, plain packaging is a really good example. We first raised the idea that this was a good public health idea. The Canadian Medical Association pitched it in the 1980s, and we didn't see it come to policy fruition in Australia, first country in the world, to 2012. That's a long time. We had lots of little wins along the way, of course. So I think being committed, forming relationships, being useful, being valuable, being responsive. I mean, it doesn't mean that you congratulate the government and never criticize them. And I think when you have strong relationships, you can sometimes step back and go, you know, not really supportive of the move the government made there. I think we need to do this more, because there's trust there. You can do that.
And is there any point in going to the dark side and talking to the tobacco companies or manufacturers or anything like that?
No. I'll just say no. And in fact, you know, I'll give a more appropriate academic answer, of course, other than just no. There is such a long history of the tobacco industry co-opting science, obscuring results, lying about their products, using front groups, doing behind the scenes lobbying where they don't disclose who they are. There's nothing to be gained from trying to have a sit down, honest conversation. There's no win-win solution. I mean, for tobacco, our goal, to put it really clearly, is to put the tobacco industry out of business. There's no sort of win-win situation here. And the World Health Organization's Framework Convention on Tobacco Control actually embeds in the treaty itself, so Article 5.3 as it's known as, that we must end tobacco industry interference in public health policy making, which is essentially a fancy way of saying they are not a legitimate stakeholder in tobacco control.
Right.
And, you know, when we look at, for vaping, for example, we have a lot of high profile campaigns running right now that are being fronted by vaping retailers, small retailers. But when you step back and ask questions about who's funding those campaigns, it's the tobacco industry, because they want vaping products to be sold as a consumer good. They want that same model where cigarettes are sold in every community, in every street corner, everywhere in Australia, even remote Australia. It's easier to get your hands on a pack of cigarettes than, you know, a loaf of bread, right? Fairly available. They want that same model for vapes.
How effective do you think, in what ways has your research directly impacted, do you think, on policy or policy thinking? For example, there was a recent change to, correct me if I'm wrong, but vaping is now only legal as a prescription product.
Mm-hmm.
Do you think your research or research in general in vaping shaped that policy response?
Yeah, I think the biggest policy change we've seen is that all vapes now, regardless of nicotine content or not nicotine content or device type, have been are no longer allowed to be imported into Australia unless they're for medicinal purposes. So they're being prescribed by a healthcare professional for the purposes of quitting smoking, and then they'll only be available in pharmacies. We have this massive loophole where non-nicotine products have never been regulated properly. And we all know that that was actually wink, wink, nudge, nudge, because they all contain nicotine. And so we really identified that in our Gen Vape study as the reason why what on paper looks like good policy, nicotine vaping products only available by prescription, great. Why that wasn't working was because of this non-nicotine loophole that just wasn't being enforced. And our research clearly showed that young people could go into any shop and buy a vape. They knew it contained nicotine, and that's what they eventually wanted. And we were really able to just draw sharp attention to that and expose this massive loophole in policy. And then Generation Vape researchers, partners were invited to Policy Roundtable to present that research and show, you know, you could solve this by treating non-nicotine vapes just like you treat nicotine vapes.
Right, so surfacing what on the face of it looks like pretty basic evidence.
Yeah.
That's had an effect on the shape of the legislation.
Absolutely. And just showing that, you know, the vapes themselves, you know, kids were seeking out the flavors, that they were seeking out the nicotine, that they were finding it really easy to get their hands on these things, and that we had to address access and supply, that it wasn't going to be enough just to have education campaigns. Because in our research, we were able to show kids agree, vapes are harmful. Kids agree, vapes are addictive. There's not sort of some, you know, knowledge deficit there that is why they're using them. They know these things, but vapes are so readily available, they're so socially acceptable. They, you know, kids are getting these really mixed messages on social media with all the marketing as well. And so again, being able to challenge, like, no, you can't solve this just with an education. We really need this policy push. And you've got a big glaring loophole here that retailers are exploiting. And at the end of the day, our research showed that they're exploiting kids.
You said something interesting before, that you're not so concerned about publishing stuff, you're more interested in getting in front of parliamentary committee,
Yeah.
etc. I think a lot of researchers are worried about publishing because that's the way the academic framework
Sure.
works. Do you think it matters where you publish it? Having a big splash in the Lancet, is that better or what?
Oh, look, I wouldn't say I'm not worried about publishing. Publishing, obviously, that's something as an academic we absolutely have to do. It's part of our job description. And putting things in an academic journal is important because they do get peer reviewed and they get shared more internationally that way. So it's not that it's unimportant. For me, it's not just, it's almost like the first step, really, in some ways, because you want that evidence to go other places. And evidence doesn't speak for itself. It needs someone to advocate for it. It needs to get into the hands that people can actually use it. And I published in domestic journals in Australia that have had huge impact for me. I've published in international journals where maybe that paper's been cited by 3 or 4 other people and then died a very slow death. So getting published in a big international journal is no guarantee of policy impact. Obviously, there are some like big journals that every researcher like, oh, paper in Nature, my career is sewn up. But that's not how it is for most of us. Most of us, particularly in public health, we want to publish in places where people are, 1, going to read it, 2, access it, and 3, we can share it with people and have a policy impact.
Your research is specifically into vaping and has got quite a bit of media interest. And you yourself have been interviewed on all sorts of high-profile programs about your work. What do you think about the role of the media as a catalyst in ensuring research has impact? And are there positives? Are there negatives as well as positives? And do you have any advice on how researchers should engage with the media?
Sure. I really like working with the media, and I feel that they're a crucial part of policy impact. And even if you can't get in to see every politician, every public servant, they all consume news media. And particularly political staffers are voracious news consumers, particularly of issues that apply to their minister, right? And so you being on those news programs, presenting your research, saying, how it's going to impact policy, how it should impact policy, is a way to get in their ears as well. It also is a crucial way of bringing the public along, as a way of informing, way of showing the importance of issues. I mean, not every news media article I've ever been involved with has been an overwhelmingly positive experience, but as a whole, absolutely. I think it's crucial to our work. And science communication, where you're able to take something that maybe is quite methodologically complicated or is quite theoretical, and being able to distill that down into meaningful health impacts and describing it to audiences, I think is a real skill. And I worry that sometimes those softer skills about science communication and bringing the public along get dismissed. It's like, oh, well, you didn't run a clinical trial. It's like, yeah, but I made sure that the general public understood what a clinical trial was. And those skills are really crucial. Not every academic wants to do that, and I think that's fine. Not every academic can do everything, but for me, it's a really important part of my work.
In the interface between governments and policy changes and researchers, do you think there's enough being done to engage the two sides? Do you think there are the right structures in place to facilitate engagement, or do you think more things could be done?
I would love to see more direct engagement between policymakers and researchers. I think there's only good things to come of it. I think in terms of structures, I don't know. Often we think we need big formal systems to make that work. And I don't know, for me, it's been more about forming relationships and being available and sharing my work with people and not being afraid to call up the policy officer at the tobacco control unit at New South Wales Health or the tobacco control team at the federal government Department of Health and say, hey, we've got this new paper coming out. We think it might be really of interest to you, or we'd be happy to give your staff a briefing on it, and just being useful and helpful. I suppose if there's more formal structures in place to do that through, I guess, conferences or, policy evidence exchanges, that could be very useful as well. But I certainly wouldn't pretend to be an expert on how to make that happen.
But you are an expert in talking to policymakers and talking to the media, etc. And I just wonder, and a lot of researchers are not, and they're nervous about all
Sure,
that,
yeah.
and also they don't necessarily have the right language for it.
Sure.
Do you have any tips into kind of emerging researchers about who are hoping to impact policy with their work and what they should be doing?
Yeah, well, if you're based at an academic institution and you're really interested in getting your work into the media more, work with your media office. Our media office here at Sydney Uni is hugely supportive and wants to see our work out in the broader community, wants to help us have media opportunities. And media doesn't have to be, the front page of the Sydney Morning Herald. Media can also be small community radio. It can be, say you're working on a multicultural health project. It can be really small community radio station where you warm up, where it's really friendly. So it doesn't have to be an all or nothing. And increasingly, obviously, a lot of academics are even controlling their own media presence through their own social media channels and their blogs, LinkedIn posts, you name it. That can be a really good way to get warmed up as well. There's lots of training you can go through as well. You don't just have to wing it. Again, I think there's this idea that some people are good at media and some people are bad at it. It's like, no, these are skills that we learn. Just like you learn how to do biostats analysis or qualitative research, you can learn to speak to media and how to do that as well. It's a skill that you can develop.
And just finally, I know you've just come back from a WHO tobacco control conference in Panama, and I was wondering whether there were any interesting lessons there in terms of research translation that you picked up, talking to your colleagues in the international sphere.
Yeah. Oh, look, the World Health Organization's FCTC, Freeman Convention on Tobacco Control, is actually the epitome of research translation. It is this recipe book based on evidence of what exactly we need to do to reduce tobacco use in communities. It's about proven policies, the suite of interventions you have to implement, how you even evaluate that. And it's bringing together people from public health, from law, from economics, government, you name it. They're all at the table and influencing the sort of progression of the treaty. And NGOs are there as observers to sort of keep the processes honest. The parties are primarily, government stakeholders who are represented as well. But the tobacco industry has also been able to sort of worm their way into those processes. And some countries, some parties are more tobacco industry friendly than they ought to be. And they can use process tools like delaying agendas and fiddling with words on documents. And because of the treaty process is about consensus, but there's no voting. You don't vote at these FCTC meetings. Everyone in the room agrees. And you just have one party who puts up their hand and goes, I don't really like the fourth word on page 5 for this. And a whole other round of consultation. And you can just see how that's ripe for abuse from the tobacco industry. And so having NGOs there and skilled policymakers there to be able to call that out is hugely important. But the FCTC itself is an evidence-based document. There's nothing in there that hasn't been proven to be an effective way to reduce tobacco use.
Okay, well, thanks so much for talking to us, Becky. That was a really fascinating conversation, and I think vaping is a really good case study, particularly right now as new regulations are emerging into exactly how research and policy can interact and research can have impact and feed into significant policy change. So thank you very much.